Welcome to Mountain Health Today. I'm Ted Owens, your host, and this program is brought to you by the Tahoe Forest Health System. Today we're going to be talking about state-of-the-art technologies available right now, today, at Tahoe Forest Orthopedics and Sports Medicine. And with us, our guest, as always, is Mr. Harry Weiss. Harry is the president and CEO of the Tahoe Forest Health System. Harry, pleased to have you with us today. Welcome.
Happy to spend several minutes with you and talk about this great variety of services.
Well, Harry, you have a wonderful orthopedics department. I'm a frequent flyer. I have to disclose that. Wonderful team. But the skilled orthopedic professionals at Tahoe Forest Orthopedics and Sports Medicine are committed to offering the latest in technologies. Why don't we start with the VELIS robotic system? If you would, and share with us what that is and why it's important.
Sure. Several orthopedic centers around the country have adopted robotic-assisted orthopedic surgery, and Tahoe Forest made a decision that we wanted to use the most advanced robotic assist knee replacement surgery technology that's available anywhere in the United States. And so we have chosen the VELIS robotic assisted knee replacement tool here for our orthopedic surgeons. And again, every knee is different. Some of the previous versions of technology just weren't as precise as the new VELIS model, and we're excited to really talk about how this can create a better outcome for our knee replacement patients.
So this system, Harry, is really about precision, and it's an assist robot, just so the folks know at home. It's not a robot performing the procedure, correct?
That is correct. The surgeon is in charge at all times, and he's specifically marking out all of the parameters of the person's anatomy, the patient's anatomy, and then the surgeon goes to work. And what this does is the computer has carefully noted, the unique anatomy in and around the knee and so forth, based on all the tracings by the orthopedic surgeon. And then that allows for all of the specific cuts and the trial placement and the final placement of the implant devices to be really placed in a superior set of positions for a great outcome.
How accurate are we talking about? We're not talking about, 3/8 of an inch. You're talking about hundredths of an inch in terms of accuracy, correct?
That is correct. Patients that go through a knee replacement surgery, the knee is probably one of the most complex joint replacement surgeries, and our goal is to find, the perfect angle as the lower end of the femur is removed or the top of the tibia is removed, and then as you place in the joint replacement for the knee, that not only do you have the right length, but you have the right balance, the right weight distribution, the right level of range of motion. And what's beautiful about this is because the VELIS system has carefully tracked your unique bone structure, it helps us to really optimize the balance of how these components come together, both for a standing position, walking, bending, flexing, and so forth. It's an amazing assistant tool.
So really this, Harry, is a benefit to the patient in terms of mobility. I would imagine maybe less pain post-surgery. What does the patient really experience immediately after this procedure?
Yes, it can definitely contribute to less pain, and we have some other companion new technology as well that helps in that. But for example, when you go and you walk, if the weight is distributed evenly on the inner and the outward or the center portion of your implant, which is more achievable with the robot assist device, you are going to have much greater comfort, which then allows greater calmness as your body heals and adjusts to the new implant. And range of motion, is enhanced as well. So a surgeon can complete in a high quality way without this, but this is a great addition to great skills of an orthopedic surgeon.
And Harry, we've got a couple minutes here, but what can a patient expect? Can they get back to, the types of activities that they did before? Are they limited?
The physician will describe, based on a variety of other health conditions that a patient has, and their physical therapist as well will really describe, because we have a very careful program that it's important for our patients to know that every patient goes through a preoperative program where you meet with our physicians, you meet with our physical therapists, you then have the procedure, and then you have a custom progress plan afterwards. So all of this is custom to each person so that there aren't false expectations as to what is going to be pre-surgery and post-surgery to have a good outcome. So yes, we're excited about how patients can really improve their joy in living and greatly lower their pain. But the important thing is that we have this pre-surgical program, you get a great surgery, and then we have a great post-surgery program that's customized for you too.
Thank you, Harry. We've been talking about the VELYS robotic assisted solution. This is Mountain Health Today. We'll be back in just a moment. This is Mountain Health Today. I'm Ted Owens, and I'm speaking with Harry Weiss, President and CEO of the Tahoe Forest Health System. A few moments ago, Harry, we were talking about the VELYS robotic assisted solution for knee replacement surgery. Let's shift gears a little bit. We touched on pain management a little bit, and I know you were ready to talk about this next technology, the iovera treatment. So tell us, what is the iovera treatment?
Sure, and just to provide a little bit of context, our first segment was on the VELYS robotic assisted solution, which is for knee replacement only. It's not for hip replacement, shoulder replacement, or those kinds of things. And now we're going to talk about iovera cold therapy treatment, which is also just for the knee presently. It's FDA approved just for the knee. And what we observe is out there are many, many patients who have never had surgery. They have a period of months or years where they're really experiencing increased pain, chronic to acute pain. And that can be caused by a variety of wear and tear or other issues in the knee. And for the first time, we have a great solution for our patients, which may give them actually many years of life to avoid a significant invasive surgery because of this iovera cold therapy treatment device. It's a small handheld device that's only used by trained professionals who are a orthopedic physician or a specially trained physician assistant. And this cold therapy, how it works basically is there's just a very localized injection in the upper area above the knee where you have some specific nerves. We do use ultrasound assist where applicable in that. And this cold therapy then can reach those applicable nerves And the nice reaction to the cold therapy is that your knee pain will cease to occur for many weeks, up to approximately 3 months, from this cold therapy that specifically pinpoints the nerves above the knee. The beauty of this is you get pain-free ambulation, you get months or years of additional knee activity, and also you're able to avoid oral medications such as Advil or other stronger medications that might be opioids or other types of narcotics that could have all other types of side effects. So it's a more medicinally free process for you, and your nerves and your above the knee and the muscles above the knee tolerate this very nicely and give you a pain-free condition for many weeks that's highly desired.
Harry, I have a question. So as I understand it, the iovera treatment might be able to help people put off a major knee replacement or other surgery for a period of time as one benefit. Does it sometimes eliminate the need perhaps for a surgery and solve other problems for the patient?
Yeah, I'm not sure that there's evidence that it would eliminate the need for a surgery forever. But I think if a person can go additional weeks or months or years without it, that's really an important quality of life issue. The other important part of iovera is it's a wonderful tool post-surgery for a variety of knee surgeries that a patient might have had. Let's say it's an arthroscopic surgery of some type, or it might be a surgery that's a total knee replacement. What a great alternative to having to take narcotics, opioids, or a lot of Advil type of pain relief products.
Well, I think it's minimally invasive. It doesn't have any side effects, correct?
That's correct.
So, how does one receive this treatment? What do they have to go through first before they can receive a treatment like this?
They would contact our orthopedic and sports medicine program, and they could certainly call 530-451-0615 or call Tahoe Orthopedics and Sports.com, which we can also mention a little bit later as well, and call and have an evaluation in the office to see, are you a candidate for this in a pre-surgical mode, or it'll obviously be recommended in a post-surgery mode too, if applicable. And we're finding that it is widely accepted, it's widely sought after, and I think there's at least one day a week right now that's heavily focused on patients coming into orthopedic offices and having this elective procedure in the office. They get it done and they walk out, with a, nearly pain-free or pain-free environment, very different than they walked in. So it's an amazing, minimally invasive.
Well, and I think that one of the things that appeals to me, Harry, is it's not a deep needle injection into the knee like we've seen in the past, or as you pointed out, loading up with ibuprofen or other things that may have other side effects with you.
The beauty of this is this isn't an injection in the knee itself. This is above the knee, so that knee is preserved.
Okay, thank you. We've been talking about state-of-the-art technologies at the Tahoe Forest Orthopedics Center. We'll be back in just a minute. back with Mountain Health Today. I'm Ted Owens, your host, and we've been talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. And we've been talking about state-of-the-art technologies available now at the Tahoe Forest Orthopedics and Sports Medicine. We first talked about the VELYS robotic assisted solution for knee surgeries, which is a robotic assist to the surgeon in that procedure. And we've talked about iovera treatment, which is a focused cold therapy to eliminate pain and perhaps buy more time before you might need a knee surgery. And Harry, we're going to shift to another technology that you have, the ultrasound guided injections. And just the name of it sounds very interesting. What is it?
Yes, we're really pleased that our orthopedic surgeons do have, and sports medicine as well, portable ultrasound machines that a trained physician can do an ultrasound procedure over a particular joint area. Let's say it's a knee or a shoulder or hip joint, and evidence-based medicine, may suggest that a particular type of medication can be injected into that particular area, the knee or the shoulder or the hip, to really alleviate the discomfort that the patient is feeling. The beauty of this is these physicians are highly skilled and have done this for a number of years, but they're able to really pinpoint the area of that joint, the knee, the shoulder, the hip, etc., much more carefully and precisely now with the assistance of an ultrasound tool. And this can really create an improved patient therapeutic benefit from having the ultrasound assistance. So,
Harry, I don't mean to interrupt, but I have a question for you. I want to, so we don't confuse folks at home. The iovera cold therapy treatment is isolated to just the knee, correct?
That is correct.
Okay, and the ultrasound guided injection is any and all joints?
That is correct.
Okay.
And the iovera too, its therapeutic work is just above the knee, so it doesn't do anything within the knee joint itself, and it gives you that pain-free experience. And we can use ultrasound to precisely find those nerves above the knee that then iovera precisely targets in a very minimally invasive way, so that you can walk into the office and walk out enjoying a nearly pain-free experience. So again, ultrasound is for all areas, whether in this case it's above the knee or joints, as you just said, whether it's the knee, the shoulder, the hip. And in these cases, there may be an injection right into the knee joint or the particular joint in a particular spot. And that's why it's so nice to have the ultrasound tool to help.
Okay, so the ultrasound tool actually can work in concert with iovera.
Absolutely.
It's not an either-or proposition.
That's correct.
And tell me, you've got some wonderful technologies. We've talked about 3 today in the Orthopedics and Sports Medicine Center. I think it's important to mention that how some of this technology has arrived in orthopedics. And I would be talking about your foundation. Would you like to share with us a little bit about the foundation's involvement in some of this technology?
Yeah, we're really appreciative to have community partners who place their hearts and their time and their money focusing in on great healthcare in our region. And so our Tahoe Forest Health System Foundation has been the recipient of some great donations, and they in turn have a fund that's called Area of Greatest Need. And the board of the Tahoe Forest Health System Foundation approved a very generous donation to cover the cost of the VELYS robotic assisted solution. And this is what really helps a rural health system be a great health system, to have our community help us philanthropically to be able to purchase a piece of equipment that is more than $500,000. And we're just extremely grateful for our community that helped us with this and our foundation's assistance.
And Harry, if folks are feeling philanthropic, where can they go to find out more information about the foundation?
Yes, they can go to tfhd.com/giving. And again, it's very important for all donors to understand that we are very different in a positive way, in that 100% of every dollar they donate goes to affect patient care as to equipment or space or whatever was that donor area of interest. $0 go to administration. And virtually no other foundation has that principle that they use.
This has been Mountain Health Today, and we've been talking to Harry Weiss, President and CEO of the Tahoe Forest Hospital System. And this program, we talked about state-of-the-art technologies that are available in the Tahoe Forest Orthopedics and Sports Medicine. We talked about the Veli's robotic-assisted solution, which was gifted to the hospital system by the foundation, the iovera cold therapy treatment, and ultrasound-guided injections. Harry, for more information just on the Veli's robotic-assisted solution before we go, can you direct folks to where they can find out more, and then we'll say goodbye.
Yes, please call 530-451-0615 or visit TahoeOrthopedicsandSports.com.
Thank you very much, Harry, and thank you for watching at home. This has been Mountain Health Today. I'm Ted Owens, your host, and been speaking with Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, thank you, and the folks at home, thank you for tuning in.